Hello, my name is Molly Manley. I'm a hand and upper extremity surgeon in Akron, Ohio, and today we're going to talk about mucous cysts. So this is a small area that forms on the finger near the nail and can even make the nail have a lot of changes where you can see how flat it is. There's these other small examples that almost looks like a wart where it actually erodes the skin, but it is not. And so how to do this is we actually numb up the finger, and so we do this what's called local anesthesia. So we only numb up the finger and you do not actually need to go to sleep. So we numb up the finger all around it so that the finger is nice and numb, but you don't feel the pain of surgery and you don't have to go to sleep. And so then what we do is we take what's called an S-mark, and basically it's like a rubber band where we wrap around the finger, and this gets all the blood out of the finger. And so once we kind of get the blood out of the finger, then we're going to wrap another band at the base to keep this so that there's no blood loss during surgery. And so why we do this is these cysts can be painful and they can also rupture, causing pain and infection. And so when we do this, you can first kind of see that cyst is marked out, and again, you can see nail changes from that cyst sitting on that nail. So we're going to make a small incision to the side of the cyst just through skin. After we get through skin, we can actually sometimes even squish out that fluid. And so it's a very clear, sticky fluid, kind of almost the consistency of Caro syrup, but it's mucin, so it's a thick fluid. And so once we get through that skin, basically, we're going to first take the cyst out. And so many people at home try to pop these, and they use safety pins, sewing needles, and all kinds of things, and they can get really, really infected. And furthermore, even if you take it out at home by popping it, it comes right back because there's kind of a balloon of fluid. And so what I'm doing here is I'm actually taking that balloon out so that it can't reoccur. And so if you do want to pop it at home, please don't, but also know that it's going to come right back because that sac of fluid will just fill right back up. And so after we take that sac out, I'm then going to make another incision where I'm going to go into the joint. And so part of the problem is that the cyst originates or comes from the joint. And so there's little tiny roots in the joint. So I'm going to go right underneath that extensor tendon, or the tendon that makes the finger straight, and get into the joint. And so sometimes there's actually fluid or more of that mucin and cystic material here, but I'm going to take that out with the rongeur. So I'm going to again debride kind of basically above and below that tendon, first getting the cyst sac out, then going into the joint to make sure I have the rest of that cystic material. And so once I kind of debride in both areas, then the procedure is done. And so post-operatively, those a couple stitches, you just need to make sure you keep it as clean and dry as you can. Don't lift anything heavy because basically these should not get infected unless you do something crazy. So you want to try to keep it clean and dry, and again, don't lift anything to rip your stitches out. So thank you very much for watching. If you find this helpful, please subscribe so that you can see more videos.